Hello everyone, welcome to our program introducing pathogen. Actually, we don't recognize the disease in this program, but the disease speak and introducing themselves to you. Of course, my work here to fight the disease, but I'm not alone. Mr. T-Cell. Actually guys, Mr. T-Cell will be with me throughout my programs. He has a lot of experience about the history of the disease that can give us important information in this way. Hello Mr. T-Cell.
Hello Daniel.
I think you will be helpful to us.
Yes, sure.
Okay, thank you, Mr. T-Cell. Could you help me? I need some information about the staphylococcus history.
From the Greek staphyle, bunch of grapes, and coccos, berry, staphylococcus is a genus of gram-positive spherical bacteria that commonly cause surgical and skin infections, respiratory disease, and food poisoning. In 1880, Scottish surgeon Sir Alexander Ogston first described staphylococci in pus from a surgical abscess in a knee joint. The masses looked like bunches of grapes. In 1884, German physician Friedrich Julius Rosenbach differentiated the bacteria by the color of their colonies, S. aureus, from the Latin aurum, gold, and S. albus, Latin for white. S. albus was later renamed S. epidermidis because of its ubiquity on human skin.
As I could say the snake by nice words coming out. First of all, I should be a friend with the Staffo to get to know him better. Hello Staffo, could you introduce yourself?
No, I'm couldn't. I don't need a friend. I have many friends in human body.
Oh Staffo, be sure I will be best friend to you.
Okay, I'm gram-positive and strong bacteria.
Oh, you mean you have thick peptidoglycan layer? One of the most common characteristics of the Staphylococcus, it means the thick peptidoglycan layer that can help the bacteria to protect the chemical agent and physical agent substances that can damage all them. For the chemical agent, antibiotics are a chemical agent commonly used to damage or inhibit the growth of the bacteria. They target specific compound or processes within the bacteria cell, disrupting their function and ultimately leading to the bacteria death or growth inhibition. Also for the physical agent that can damage the bacteria by the heating and boiling and autoclaving and UV radiation that can denature the bacteria protein. UV radiation can damage the bacteria RNA. Hey Staffo, what else?
What else? You want to hear about the foods?
Foods?
Yes, I like the crabs.
Oh Staffo, I know you have a cocktail chef. Mr. Tissel told me about that. Okay, Staffo, could you tell me what you wish for? Oh, Staffo, I don't want to make you sad.
It's okay, Daniel. Actually, I wish one day can breathe because of I don't have oxygen like my other friends. And to fit is walking in the rain.
Oh, Staffo, I'm sorry. I don't know how to express it. In human, Staphylococcus saprophyte found in the normal flora of the female genital tract. Staphylococcus saprophyte causes 10 to 20% of urinary tract infection in female 70 to 27 years old. As a second most common cause, community-acquired urinary tract infection after the E. coli that can displace it from the normal flora into the urethra that cause the cystitis and urethritis. A patient with a Staphylococcus saprophyte has many problems with the urinary tract, including frequent urination, pain, burning during the urination, also lower abdominal discomfort. Staphylococcus epidermis found on the skin and mucous membrane and upper respiratory tract. While it is generally harmless, it can become problematic in the certain situation, like the compromised immune system and implant medical device like the prosthetic device. Also, the patient with the Staphylococcus epidermis have fever and chills, rednesses, swelling at the seat of the medical device. Staphylococcus aureus causing a various infection including skin infection and pneumonia, also food poisoning. Some strains are antibiotic resistant that make them the challenges to treat. The symptom of the Staphylococcus aureus detected by the location of the infection. For the skin infection, boil or abscess, also impetigo is a disease of the skin. Also cellulitis. For the respiratory infection like the pneumonia, that may cause chest pain and difficulty breathing. In case of the food poisoning, like the nausea and vomiting, also diarrhea. For the catalyzed test, all Staphylococcus species are catalyzed positive when the hydrogen peroxide is put in the petri dish containing the Staphylococcus bacteria. The solution will be bubble. It means the bacteria contains the catalyst. The catalyzed enzyme is converted the hydrogen peroxide to oxygen and water. The production of the oxygen causes the bubbles effect. For coagulase test, coagulase enzyme catalyzes converting the fibrogen to fibrin. A colloid solution is added to the petri dish containing the bacteria. If the bacteria produces a coagulase positive, it means the Staphylococcus aureus. And if the bacteria do not contain the coagulase, it means the coagulase negative, and Staphylococcus epidermis and Staphylococcus saprophyticus. For novobiocin sensitivity test, we used to differentiate between the Staphylococcus epidermis and Staphylococcus saprophyte. Novobiocin is the antibiotic. We put the novobiocin disc into the petri dish with the bacteria. Novobiocin sensitive is the colony dye of around the antibiotic disc. Produce a zone of the inhibition, which means the Staphylococcus epidermis. For novobiocin resistance, the Staphylococcus saprophyte is resistant to novobiocin and can survive. No zone of inhibition since the antibiotic will not be able to kill off the bacteria. Thomas Fowler said, "The health is not valued till the sicknesses come. Keep your health."